What is intermittent fasting and how is it beneficial for health? I'm Dr. Rawat, a physician who studied nutrition at Harvard and founded website healthgroupcoaching.com. Our mission on healthgroupcoaching.com is to optimize weight, reverse disease, and slow aging. And so no matter what your aim is, I find intermittent fasting to be beneficial for all of these purposes. On the program itself, I coach on 8 topics over 8 Zoom group coaching sessions: how to optimize body weight, how to implement early time restricted feeding form of intermittent fasting, how to reverse pre-diabetes, how to reverse metabolic syndrome, how to slow aging by reducing chronic systemic inflammation and optimizing gut microbiome, how to optimize sleep and reduce stress, how to prevent bone loss, muscle loss, and frailty, and also the role of supplements to reverse metabolic illness. However, no matter what the topic is that we are covering, along with nutrition, lifestyle changes, exercise, sleep and stress management, fasting is also an integral part of the strategy. Many of the clients that I coach need to optimize their body weight, and often they'll ask me what the best food is to eat to lose weight. And while my last 2 videos, I delved over this over 1 hour, discussed how we need to prioritize those foods which provide us satiety and provide us nutrition for the minimum amount of calories. Ultimately, there is no better way of losing weight than not eating at all. While it makes a lot of sense to eat healthier foods, not eating will always be a superior method of losing weight. And so the question becomes, if you do wish to employ a strategy of fasting along with everything else, along with nutrition, lifestyle, exercise, sleep and stress management, what is the safest and most optimal way of doing intermittent fasting? Occasionally I'll get a patient who gives me a look and says why I'm suggesting something to them which seems extreme, seems outlandish, seems like something that no usual doctor would recommend to a client. And sometimes I have to explain to them that in their particular situation, this is what their body requires. Quite often I'll see young clients in their 20s and 30s with fatty liver, pre-diabetes, metabolic syndrome, polycystic ovarian syndrome. And these are clients who may not even be particularly overweight. However, the little excess fat that they have, which may be less than their peers or friends, is sufficient for them to get metabolic disease and could also result in decades of reduced life expectancy, which is why during my program, I coach on the concepts of a thrifty genotype hypothesis and a personal fat threshold. The thrifty genotype hypothesis was postulated by Professor James Neal, a geneticist at Michigan University. In this hypothesis, he postulated why it is more common for people of certain ethnicities, particularly South Asians, Southeast Asians, Hispanics, Latinos, Native Americans, why these people are more predisposed to metabolic illness like diabetes at a lower BMI. In fact, this is one reason why the body mass index threshold for these ethnicities has been set at a lower level to be diagnostic for obesity and overweight. His postulation is that this is because of hardships that these populations experienced over thousands of years. Because the ancestors of these people went through periods of scarcity because of famine, drought, wars, migrations. This led to a Darwinian evolutionary selection for those people who were better at storing energy. It's a bit like a camel having that hump of energy to be able to navigate through the desert. That hump in human beings is around the belly. So that belly that you have is that camel's hump. And those people whose ancestors had difficult, scarce experiences have genetically been programmed to have that energy preferentially stored around the belly, in the liver, and in the pancreas. That's okay if you're a camel living in a desert. However, Our modern life is anything but that. Now we have refrigerators, Uber Eats, drive-thrus. We are surrounded by hyper-palatable, calorie-dense, ultra-processed food. And if your genetic makeup is one of a camel, then you will not thrive. If you're designed like a cactus in the desert and you're then planted right next to a palm tree on a beach, you will not thrive. It's like if you get a baby cactus in your bedroom and water it 3 times a day, you'll end up killing that cactus. And so what would be the way of reviving that cactus? It would be to not feed it, to not water it, to induce scarcity, because that is what its genetics are designed for. And that's precisely what we do with intermittent fasting. If you're a person who's young and despite not having a particularly large body mass index, has developed signs of metabolic illness, which are future predictors of early cardiovascular disease, such as fatty liver, prediabetes, metabolic syndrome, polycystic ovarian syndrome, then intermittent fasting is a method of inducing scarcity. It's a method of matching your environment with what your genetics were designed for. So while the standard medical establishment may consider that to be atypical advice, that is actually exactly what the doctor ordered. This is exactly what your genetics and your body want you to do. So now that we've established that intermittent fasting is healthy and is something which is beneficial for people, what is the best pattern of fasting? I believe that a pattern of intermittent fasting called early time restricted feeding is the most superior pattern. This is a pattern where you prioritize eating your food early and avoiding eating late in the day. As you can see in this study here, done by Courtney Peterson and group, they demonstrated reduction in inflammation, CRP, reduction in stress hormone cortisol, reduction in insulin levels, as well as many other benefits, even without weight loss in this study of men with prediabetes. Even the desire to eat and hunger was reduced in the group doing early time restricted feeding. It is important to point out that in that study, the participants were not allowed to lose weight. It was an isocaloric study, which means the participants in both groups had the same number of calories and they had to maintain the same weight. However, all of these benefits were seen in those doing early time restricted feeding despite not losing extra weight. The reason it's important to highlight this is because critics of intermittent fasting will often highlight that many of the benefits seen with intermittent fasting would be seen simply by weight loss anyways. And since intermittent fasting will invariably lead to calorific restriction, which would lead to weight loss, it can be difficult to tease out whether the benefit is due to weight loss or because of fasting. Certainly these days we are seeing a lot of this kind of literature for the new weight loss drugs like Ozempic. They are showing benefit for all kinds of metabolic markers, but we know that all of those things would get better when you lose weight anyways, regardless of how you lost the weight. These studies, however, show that fasting has some effects beyond just calorie restriction, and this is not the only study which has shown that. In this mouse study, for instance, again, both groups were calorie matched. So there was no reduction in calories. However, despite of that, the group of mice who were time restricted saw reduction in weight, reduction in glucose tolerance, reduction in leptin resistance, reduction in liver disease, reduction in inflammation, and better motor coordination. Dr. Sachin Panda is a leading researcher in the field of circadian biology and fasting, and his recommendation in this paper is that for the first 1 hour or so after waking up, do not consume any food, perhaps do sun gazing, exercise, go for a walk, get some of your other chores done, then consume your food. But before that, try to aim for at least 14 hours of fasting, which includes sleeping time as well, a 10-hour window going forward from there, and this would be an ideal fasting program in line with your circadian hormones. How Dr. Panda explains this in his book is that as evening sets in the evenings, our hormone melatonin starts rising. This is our hormone which induces sleep. However, melatonin is a counter-regulatory hormone of insulin, and the later it becomes in the day, the more insulin resistant we naturally become. There are good reasons for this. When we're sleeping, we are naturally fasting. That's why we call breakfast break fast. And because we are fasting at that time, we do not want to have a hypo or low sugar. The job of insulin is to pull sugar out of the bloodstream into cells. And so we become more insulin resistant in order to not get hypos while we're sleeping at night. For the same reason, however, having the same meal 9 o'clock at night will lead to a higher sugar spike than having that same meal 9 o'clock in the morning when you're more insulin sensitive. There has been evidence to show that eating the same food 9 o'clock at night will lead to more weight gain than if you eat the same food 9 o'clock in the morning. And of course, after having that food in the morning, you will have a lot more time in the day to burn those calories than eating late at night, when you will probably just end up putting your feet up, watching Netflix and going to bed, and all of that extra energy will get stored as fat. It is important to highlight, however, that the biggest benefit of intermittent fasting still lies in the calorie restriction. And so if you're someone who just cannot start eating early in the day and finish early, the only way you can possibly do it is by skipping breakfast, because you have to have the social late meal late in the day. While not ideal, it would still be better than not fasting at all. And so in my view, early time restricted feeding is the most superior way of doing it, but doing some fasting, even if you don't do it that way, is still better than not doing it. On my coaching program, I like to divide up early time restricted feeding fasting into 3 kinds of gears. Finish breakfast by 9 o'clock, and depending on where you are in your life journey, in your metabolic health journey, you should be fasting for anywhere from 14, 16 to 18 hours. So if it's 14 hours, you finish all food by 7 p.m. If it's 16 hours, you finish it by 5 p.m. And if it is 18 hours, you finish food by 3 p.m. Depends on how fast you want to go, how fat adapted you are, how metabolically flexible you are, how long you've been doing it for, how comfortable you are with it, and how much weight you need to lose, how much metabolic illness like prediabetes or fatty liver you need to reverse. Depending on those factors, you would decide what kind of gears you need to be operating on. This was an interesting study which showed that time-restricted feeding was also an effective therapeutic intervention against a poor diet. So what they did here was test 2 control groups, both of them with a poor diet comprising of high fat, high fructose, and high sucrose. And they demonstrated that those who did intermittent fasting had protection against the poor diet. So it's important to be clear. I'm not saying that you should have a poor diet and just do intermittent fasting as a detox to clear up all that debris that you put into your body. However, it is reassuring to know that even if we do slip up and don't eat what we really should, fasting can help us clear it up. And certainly in my own life, this is what I do myself. I know what an ideal diet is, and I can gauge to what extent I am deviating from that ideal diet. So if I know that on Friday night I've been called for dinner and most of the food there is high saturated fat, refined sugars, high calorie density, hyperpalatable, industrially made, ultra-processed food, then I would fast for longer, perhaps 18 hours on the Saturday. Perhaps I would skip breakfast because I would have probably been eating till late. And this is how I would compensate for a diet which was far from ideal by using fasting as a detox. So I feel that the 14, 16, 18 hour needs to be gauged based upon your own personal situation, how long you've been doing it for, how comfortable you are, how far you are from your ideal health, but also you can vary this day to day depending on how good you've been with your diet and nutrition versus how much you've slipped up in the day. So personally, I fast for 14 to 18 hours in a day, prioritizing eating early, not eating late. But this is variable, depends on how good my diet has been, how much I've exercised, what my schedule is like. And certainly there is a benefit of being flexible and changing things around. There is some evidence that doing things the exact same way every single day can lead to some degree of metabolic stagnation as well. But what if you're eating healthy, you're doing intermittent fasting, you saw some initial weight loss, but now it appears to have plateaued and you need that kickstart, that boost. That's where the 60-hour fasting mimicking diet challenge can help you. This is something that I do once a month, usually the last weekend of the month, but depending on commitments, it might be a different weekend as well. This was a 12-month randomized control trial in which one group of clients, in addition to taking metformin for diabetes control, also did a fasting mimicking diet for 5 days in the month. And it showed that after 12 months, the requirement for medication reduced in those clients who did the fasting mimicking diet 5 days in the month. What is a fasting mimicking diet, you may ask? In most cases, you're not actually fasting. You are allowed to eat calories, but a reduced amount of calories. Most of the studies that I've seen have capped the calorie count per day to less than 900 calories. There are two camps with regards to how a fasting mimicking diet should be designed. There is one which I would call the Walter Longo camp, where they feel it's important to reduce protein and carbs and so have a fat predominant fasting mimicking diet. This is because they believe in suppressing mTOR and suppressing insulin. There is another camp, and I would call that the Professor Roy Taylor camp, in which this is a low-calorie diet, however higher in protein, because not only is protein more satiating than the other macronutrients, it's also important to maintain your muscle mass when you're fasting. And I would say I veer towards the second group here. I feel it's important to exercise and maintain protein intake while fasting. I feel that calories are a much bigger player in the benefit of a fasting mimicking diet than carbs or insulin. And certainly, Professor Roy Taylor, in the books he wrote and the research he's done from Newcastle University, demonstrated reversal of diabetes on a diet which was low calorie and high in protein. Ultimately, what determined the reversal of diabetes, fatty liver, and those kinds of metabolic problems was weight loss and removal of fat from the liver and pancreas rather than the amount of carbs or the spikes of insulin. The patient group in the INTERFAST 2 study was type 2 diabetics who were treated with insulin. And in this study, the cohort who were asked to do intermittent fasting showed a significant reduction in sugar. And while 8 people in the intermittent fasting group were able to reach the primary endpoint, none of them in the control group were able to do so. The fasting intervention here was 3 days of fasting per week. And those who did this had a reduction in sugar, reduction in insulin dose, and also a reduction in weight within a period of 12 weeks. Taking insulin sometimes 5 times a day for diabetics can pose a significant psychological and financial burden on patients. And in these studies, we saw how certain patients were able to come off insulin or significantly reduce the dose and their costs of insulin. And the fact that this is something which is not discussed with clients in day-to-day medical practice, personally, I find unfortunate. Certainly, there is enough scientific evidence that we should at least make this part of the discussion. In this study, clients were asked to do early time restricted feeding. So start feeding anywhere from 6:30 in the morning to 8:30 in the morning and finish by 5 to 7 p.m. in the evening. And after doing this for 3 months, 47.2% of participants in this trial had remission of their diabetes, while only 2.8% or one individual in the control group had remission. At the end of the study, the medication cost of the fasting group was 77.22% lower than that of the control group. One of my videos on TikTok today received a community violation because it included the hashtag fasting, as if I was spreading some kind of misinformation. That is really unfortunate. So this is the 60-hour fasting mimicking diet challenge which I have designed. And personally, I do this once a month, usually the last weekend of the month. It's not really for beginners. I would recommend that you should start with fasting, maybe 12 hours, move up to 14, 16, and 18 hours. Once you feel comfortable fasting for 18 hours, then you could definitely consider yourself for the 60 hours fasting mimicking diet challenge. For certain patients, this is not appropriate, particularly if you're on insulin or if you take medication for diabetes, which could cause hypoglycemic attacks. These will be drugs such as gliclazide, glyburide, etc., commonly called the sulfonylurea group of drugs. With those drugs, there's a risk of hypo if you're fasting, and you may need to speak to your physician or pharmacist, perhaps even consider stopping that medication if you're serious about this kind of approach. But unless you do that, I would not recommend a longer fast for you. I have created a Reddit chat forum called Health Group Coaching. If you would like to join me during that 60-hour fasting mimicking diet journey, then consider joining that Reddit group. We can share pictures of our food preparation, weigh-ins, weight before starting, weight after starting, calorific values of the food we eat, etc. I do recommend that in preparation you also read my blog titled Top 3 Product Categories for Weight Loss Journey. And there are certain foods that you may want to consider in preparation for this. As an example, low-calorie rice, pasta, spaghetti, low-calorie dressings and condiments, zero-calorie electrolyte drinks, a plant protein powder, a body fat scale, a food weighing scale. The Amazon links for all of these products are within that blog. The challenge starts at 7 p.m. on Friday, finishes 7 a.m. on Monday, which makes a full 60 hours. And the 2 periods when you're allowed to eat are for 12 hours from 7 o'clock in the morning to 7 p.m. on Saturday, and again 7 a.m. to 7 p.m. on Sunday, but you are restricted to 900 calories. Now, the only way that you can really have satiating 900 calories are by consuming oil-free, single ingredient whole foods. And I have a list of certain types of foods that you may want to get from Costco or from your local supermarket. But of course, you can really eat whatever you like as long as you do not exceed 900 calories in that 12-hour period. In order to check the calories in food, I recommend you download the MyFitnessPal app. On the other blog titled Top 3 Product Categories for Weight Loss Journey, I have 2 of my videos, which is 1 hour of content on how to lose weight. I do have some supplements suggested here, which would help with your metabolism, certain types of probiotics which have shown some scientific evidence for weight loss, prebiotics like fiber, as well as plant proteins. This particular one also contains vitamins, minerals, superfoods, and probiotics, as well as certain types of low-calorie food hacks like shirataki spaghetti, rice, and noodles. The Amazon links are on the blog, as well as Walden Farms zero-calorie dressings. I have tried quite a few of these, and honestly, some of them are quite underwhelming taste-wise. So I would highly recommend check out the Amazon reviews. If the reviews are good, then it may be worth trying. When you're fasting, there is a risk of electrolyte loss. And certainly I'm someone who plays tennis even during my fasting weekend. So having 0-calorie Gatorade is really beneficial for replacing your electrolytes, but not taking in any extra calories. There are some other suggestions here on the blog, including an oil spray, utensils, and kitchen items you can consider buying if you don't have these, so that you don't automatically just throw food on a fryer and fry it, because that's a short way of exceeding your calorie targets. I personally have this particular scale which gives body fat measurements, muscle measurements, really quite useful, as well as this food scale if you're really unsure about the amount of food that you're consuming. Of course, there's a saying, whatever gets measured and tracked gets done. So whether it's Fitbits, Apple Watches, any kind of trackers, if you don't have one and you want to get onto a weight loss journey, that is something that you should be considering as well. One of the most basic things you can do when getting onto a weight loss journey is have a reliable way of measuring your steps and aiming for 10,000 to 20,000 steps per day. Some clients ask me, why not just do a prolonged water fast instead of doing this kind of a 60-hour fasting mimicking diet where you are consuming up to 900 calories on the Saturday and the Sunday. And my belief is that this is a safer way of doing it. The concern around water fasts, particularly if they're prolonged, is that they can be unsafe. They can lead to electrolyte imbalances, for example. And while there are certain residential institutions where these are done safely under close medical supervision, if this is something you'd like to do alone at home, I don't believe that it's particularly safe to do it that way. While a fasting mimicking diet, because you are allowed 900 calories on Saturday and Sunday within that 60-hour period between 7 p.m. on Friday and 7 a.m. on Monday, that is significantly safer than a water-only fast. The second big concern around long water fasts is that due to absence of protein intake and also due to an absence of activity, because once you haven't had any food for 2 days, you become quite sluggish, people do lose muscle mass. And one thing we see in the origins of metabolic disease, for example, if you see my video on YouTube titled How to Reverse Prediabetes in 3 Steps, there are 3 main steps. One is to reduce belly fat, which is a surrogate of removing fat, which is visceral, around your belly, inside your liver and your pancreas. The second step is to increase muscle mass, because that's another seat of insulin resistance. And the third is to develop insulin sensitivity through intermittent fasting. And long water fasts, because of an absence of protein intake and also because of an absence of exercise, eventually when you become slow and sluggish, can lead to muscle loss. And while the scales may look promising, that may not be in your best interest from a metabolic point of view, because ultimately your muscles are the biggest sink of your glucose or sugar. If your muscles shrink, then your sugar has really nowhere to go and ends up sticking around in your bloodstream and then into your liver, getting turned into liver fat. The third difference I see between a water fast and a fasting mimicking diet is that the latter does encourage some degree of calorie awareness. You have to download the MyFitnessPal app. If you join me on the Reddit, and we do this as a group, we all support each other in calorie counting, becoming more calorie conscious. And although you're only doing this 1 weekend in a month, the knowledge you gain from this experience will then brush off into the rest of your month as well. One good thing about gaining knowledge is you can unlearn what you've learned. Once you have noticed the difference in calories between mustard, tomato ketchup, mayonnaise, and peanut butter, you can't unlearn it. Now you know this. And next time you're reaching out for a condiment or a sauce, you know which one would be better from a calorie point of view. And that is the kind of knowledge which will help you in the longer run. And I find that a lot of people who do just intermittent fasting and perhaps long water fasts don't really tend to delve into that aspect of their health. As you will see on my coaching program, intermittent fasting is important, but it's not the only important thing. On my 8 lessons I coach on my program, intermittent fasting is one of them, but there are 7 others. The mission on the program is to optimize weight, reverse disease, and slow aging. This is done through 8 Zoom coaching classes in a group setting, usually on Tuesdays and Thursdays at 9 p.m. over 4 weeks. The groups are divided into months, and the classes are on optimizing body weight, intermittent fasting, reversal of prediabetes, reversal of metabolic syndrome, slowing aging by reducing chronic systemic inflammation and optimizing the gut microbiome, optimizing sleep, reducing stress, preventing bone loss, muscle loss, and frailty, and supplements to reverse metabolic disease. If you would like to join, then just click on the subscribe button on the website and you will get the options to subscribe. There is a free option if you just wish to receive recordings of the sessions. And as I had mentioned before, there is also a Reddit thread which you're free to join, particularly if you want to join in the fasting mimicking diet challenge for 60 hours. If you do so though, make sure you read the blog on the website first so that you can be prepared for it. I hope you found the video useful. If you did, then remember to subscribe, like, share this video with someone who will benefit from this information. Consider subscribing on the coaching program. Consider joining on the Reddit. If you'd like to watch a video on how to reverse prediabetes or how to reverse fatty liver, then click on those videos and I will see you at the next video.